Okay, finally moving on to the muscles that are found within the boundaries of the hand. These are known as the intrinsic muscles of the hand. In other words, these are muscles that have their proximal and distal attachments within the boundaries of the hand itself. Anatomically, we divide the intrinsic muscles of the hand into three distinct areas. The thenar eminence, which are the muscles at the base of the thumb. There's the hypothenar eminence, which are the muscles at the base of the little finger. And then there are the muscles in the hand itself, in the palm of the hand, the interossei and the lumbricals. Starting off with the thenar eminence, here is the thenar eminence. We can see the thenar eminence quite clearly here. So here's the thumb, here's the wrist joint itself. Over here, the thumb has now been transposed to the opposite direction for some reason. But these are the muscles of the thenar eminence down here, and they're divided up into deep and superficial layers. The superficial muscles are the muscles of flexor pollicis brevis, which arises here from the tuberculum trapezium and the flexor retinaculum, goes off and attaches onto the base of the proximal phalanx of the thumb. And this next to it is abductor pollicis brevis, which is a little stout muscle that again arises from the flexor retinaculum to the outer, to the radial aspect of the base of the proximal phalanx. Function of these two muscles are obviously to produce flexion of the thumb for flexor pollicis brevis, or abduction of the thumb for abductor pollicis brevis. But if we peel those two muscles back, we end up seeing two more muscles, and here they are. As I said, this is the thumb on the left hand side this time. And there is this first muscle here, this large triangular structure, which creates the palmar aspect of the web space of the hand. This is known as adductor pollicis, which arises from two heads. A transverse head, which comes from the shaft of the third metacarpal, straight across the base of the proximal phalanx of the thumb. And an oblique head, which comes from the palmar aspect of capitate, and a few fibers come from the flexor retinaculum. Again, it goes off to the palmar aspect of the base of the proximal phalanx. And this is a fairly powerful adductor of the thumb. The role of adductor pollicis is that it draws the thumb medially, so that to sort of reinforce grips, in particular power grips. Then we've got this muscle here, opponens pollicis, which comes from the flexor retinaculum, a little bit from the tuberculum scaphoid, and it comes up and it wraps itself around the first metacarpal to produce the movement of opposition of the thumb. So what it does, it has the effect of drawing the thumb across to the palm of the hand, and it has partially the effect of rotating that metacarpal as well, so that the thumb pad ends up opposing, so it ends up facing the remaining digits. The nerve supply of the thenar eminence is via the median nerve, except for the adductor pollicis muscle that's supplied via the ulnar nerve. When we move over to the hypothenar eminence, again this is divided up into deep and superficial layers. The superficial layers include abductor digiti minimi, that comes here from pisiform and flexor retinaculum again, across to the base of the distal of the proximal phalanx of the fifth finger. And then we've got flexor digiti minimi, which is a small muscle that sits on the anterior aspect of the palm of the hand, again arising from flexor retinaculum, going off to the base of the proximal phalanx of the little finger. One abducts, the other flexes. And then again, deep to that, we've got this muscle here. There's the little finger. This is the fifth metacarpal. We've got opponens digiti minimi, which does the same thing as opponens pollicis does. It goes from the flexor retinaculum, it wraps itself around the fifth metacarpal to produce the movement of opposition of the little finger. And this is why we can actually change the palmar aspect of our hand into a concavity, because we're able to oppose the thumb and the little finger. The nerve supply of the hypothenar eminence is the ulnar nerve C8 and T1. In the palm of the hand, we have three sets of muscles. The first ones are the palmar interossei. These are a series of unipennate muscles that attach to the shafts of the corresponding metacarpals and go off to the bases of the proximal phalanges of the index finger, the ring finger, and the little finger. So here we can see the first palmar interosseus going from the shaft of the second metacarpal, goes off and attaches onto the base of the proximal phalanx. This is the second palmar intraosseous, and there's the third palmar intraosseous. The function of these muscles is to produce the movement of adduction at the metacarpophalangeal joints. So they will pull the index finger towards the middle finger, the ring finger, and the little finger again towards the little finger. Remember that the midline of the hand is that second finger. The nerve supply of the palmar intraossei is the ulnar nerve, C8 and T1. The dorsal intraossei sit posterior to the palmar intraossei. These are bipennate muscles this time. The first dorsal intraosseous here attaches from adjacent sides of the first and second metacarpals. It goes off and attaches onto the radial side of the base of the proximal phalanx of the index finger. The second metacarpal does a similar thing. It goes from adjacent sides of the second and third metacarpals onto the radial side of the base of the proximal phalanx of the middle finger. The third intraosseous goes from the adjacent sides of metacarpals again, but this time it goes onto the ulnar side of the middle finger, and then the fourth dorsal intraosseous goes from adjacent sides of metacarpals onto the ulnar side of the ring finger. And the function of the dorsal intraossei are to produce the movement of abduction. So in other words, the index finger is drawn away from the midline, the ring finger is drawn away from the midline. The middle finger has two dorsal intraossei attached to it. If it pulls the middle finger towards the thumb, that's the movement of abduction because it's movement away from the midline. Again, if we bring it back to the midline and take it the other way, again, that is also the movement of abduction because that is also the movement away from the midline. So the palmar intraossei adduct the digits, so they adduct the index, the ring, and the little finger. The dorsal intraossei abduct the index and the ring and the middle finger. The thumb has its own abductors and the little finger has its own abductors. Nerve supply of the dorsal intraossei once again are the ulnar nerve C8 T1, and a small point to note is that the first dorsal intraosseous creates the flesh in the web space, the posterior aspect of the web space. So anterior to the first dorsal intraosseous is where we find adductor pollicis. On the posterior aspect of that web space is where we get the first dorsal intraosseous. The lumbricals are four soft tissue muscles. These are comparable to the lumbricals down in the foot. They basically attach to the tendons of flexor digitorum profundus, and they blend into the dorsal digital expansion of extensor digitorum. The first pair of lumbricals are unipennate and the second pair are bipennate. So the first lumbrical here that we can see over here on the medial side, that's a unipennate muscle. Then there's another unipennate muscle here, both sitting on the radial side of the tendons of flexor digitorum profundus, going into the radial side of the dorsal digital expansion. These two muscles here, the one to the ring and the one to the little finger, are bipennate muscles going from adjacent sides of flexor digitorum profundus, blending into the dorsal digital expansion of the ring and the little finger. The nerve supply of the lumbricals is via the ulnar nerve for the medial pair and the median nerve for the two lateral pair, C8 and T1. The actions of the lumbricals are that when they contract, they will produce flexion of the metacarpophalangeal joints, but because of their attachment into the dorsal digital expansion, they create extension of the interphalangeal joints, and they classically will lead to the development of a grip known as a lumbrical grip. This is where the fingers are held extended and held along the line of the object that we're holding. So for example, if we hold a book, we would often want to place our fingers flat against the book with our thumb on the opposite side. That is an example of a lumbrical grip, and the lumbricals are particularly useful muscles for doing this particular type of grip. Nerve lesions of either the ulnar nerve or the median nerve will lead to an inability to correctly perform this grip, usually in 2 out of the 4 digits, depending on which nerve has been sectioned.